Here we go. I'll just try and keep some of the warmth in the room.
You busy?
Oh, very, very busy actually, yeah. Now, is that sore at all, that red mark?
No, that's a burn from my jam. It popped out the pan when I was making it the other day.
Oh dear. That's not so good.
No, it wasn't good at all.
So it just spat?
Yeah.
Did it? Right,
just as it was finished, it went psh. First time I've ever had that in all the years I've been doing it.
Yeah, you've got to be so careful. Yeah. Try and relax that arm and shoulder for me. That's still on the way down, isn't it?
It is.
That's
I don't get
good.
the pain in the back like I used to.
Oh, brilliant. That's good. So you're doing lots of needlecraft?
Oh yeah, yeah.
Oh, because this is around about Christmas, isn't it? All the busy time.
Yeah, I just finished doing Emmy's winter scarf, gloves and beanie hats.
Oh, is that the fashion now?
Yeah,
is it?
But she wanted bubbles on her beanie hats. She didn't just want a beanie hat, it's got a huge bubble on it.
How old is she now?
7.
7?
6, sorry.
Oh, Christ.
She just won her first
seems like only yesterday she was 3.
Yeah, no, she's just won her first dance awards. She wants to be like the girl who danced at Vic's wedding. So she goes ballroom.
Try and relax that a little bit more, yeah.
She goes ballroom dancing,
and
disco dancing. She just started ballet.
Well, you've got a tradition in the family on Vic's side with that, haven't you? Weren't they fabulous at your wedding?
Well, that's why she keeps saying she wants to dance like Katie.
Oh, is that who?
She's fascinated by dancing, but she's got a big trophy, a small trophy, and a medal, and she's only been going since the end of May. She didn't go all summer.
So were they married before you?
No, this was Vic's birthday.
Oh, the birthday. Oh, yeah, that's
they
it.
were the
Because
little
they
kids.
all grown up then, yeah. Yeah,
wouldn't dance at our wedding, but willingly danced. I mean, that was a superb thing they put together, the pair of them.
Oh, it was, yeah.
That's what gave little one the idea that that's what she wanted to do.
Right, is that sore?
No, it's not sore at all.
No, it's okay if I run over it then, is it? Okay.
No, I shoved it straight under the tap and I realised what had happened. I had to get the jam off the thing first.
Of course, yeah.
I thought, I don't want this jam burning. Tell with my arm.
So you were very naughty, you didn't put it straight under some cold water then?
No, I grabbed a big pot because I got a huge preserving pan, got that off the stove, then went to the sink and shoved it under. It does work though if you stick it under until it stops burning.
Oh yeah, that's what they say to do, but not under a jet of water.
No, just a little
because
trickle.
Because that'll blast the surface skin off, which is not what you want.
It's a bit more lumpy than normal, isn't it?
It's, I don't know, it's not too bad.
Oh, good.
You're still using the silicone gels?
Yeah. Not
that.
No. Yeah, not that amount because I can't put it on until I finish sort of work. But it does help. It really does.
What do you do? Have them on in the day or overnight?
Overnight. But then sometimes I find I've forgotten to put a bandage round it, and it's come off with the bed.
It's on Vic's nose or something.
But if it's particularly sort of, you know, I've given it a hammering during the day, I'm sensible. Because I probably am not the best customer. Because these, you know, to my mind, these things have got to be done. Like I'm leaving here and going to craft.
Oh, are you? Right, okay.
And I just look at my friend, she's riddled with arthritis.
Oh.
She's had arthritis since she was 23. She's on a stick. We both broke our ankles the same time, and you know, I just look at her and think, God, you're a lucky woman.
What, your most recent ankle break?
Yeah.
Right, okay.
Yeah. I found out halfway through me
The one that
around.
the NHS didn't find.
Yes, yes. I mean, surely. Well, they did it with Tammy. Same hospital, about 10 years before. She was walking around on a broken ankle, but she had terrible trouble. She ended up on, when they did do anything, she ended up on crutches.
Really?
Mm.
Oh dear.
She was on crutches and then she was on a stick for about 8 years.
8 years
Yeah.
on a stick?
Yeah. They tried all sorts of treatment. They gave her radioactive stuff, and in the end I said, Tammy, you're just going to have to learn to live with this. Because every time they treated it...
What, the radioactive tracer to see what was healing and what wasn't?
And then they gave her another treatment where they put a tourniquet on a on a thigh, and they injected into it, and she had to sit in a special place all on her own for about 4 hours, and she wasn't allowed for a week near pregnant women or people with kids. And I thought, this is getting more and more extreme, and it wasn't doing any good. She had one of these Tynes machines that were useless, and you name it.
Oh, the TENS machine. Yeah.
She had every sort of treatment under the sun because she was only young, and that's how she came to work with me, because she couldn't work because she couldn't up and down stairs.
Really? Oh, right.
And she was crawling up the wall, so I took her into work with me, and that's how come she's now the manager there.
Oh, that's wonderful.
Yeah. Well, because she was a secretary at Glaxo's when she did it. She was only 17.
Oh, really?
Yeah. And I'm sure that's what gave her IBS. Sure of it.
Oh, what, them messing about with the system?
Yeah.
Or the drugs anyway, I suppose.
She was on terrifically high sort of painkillers and that. But gradually, just gradually through the years, it sort of found its own level. And that's how come Vic's got a stick.
Oh, that's hers, is it?
Yeah. But she hasn't needed it for about 15 years now, because it will never be 100%, and when she's tired you know she's got a problem, but other than that you don't. I think sometimes your body does get it, just accepts it and gets on with it. Whereas I think every newfangled thing they decided to use.
Yeah, it sounded like they use her for a guinea pig for a lot of things there, doesn't it?
But they told her she hadn't even sprained it and she could go on holiday. And of course when she came back, she had done sort of an awful lot of harm.
Oh dear.
Now what's this bit of technique called?
This bit, we've loosened off both sides of the hand, your thenar and hypothenar muscles either side here, and now we're just going to relax the very centre of the hand, because this is where everything, when you grip something, all the forces end up being centrally focused here, right at this point. And this is right at the start of the carpal tunnel. So anything we can do to relax this area is going to have an effect around the whole hand. And as you can see, it takes quite a time for it to respond to the pressure, but it does continue to relax. Have
you got pressure on that?
Yeah.
I can't.
It's only a light pressure. I don't need to keep adding pressure to this point. I'm registering a presence at that point, so that I can just slowly keep that same pressure, and then without me adding pressure it will begin to relax, and slowly the thumb will start to sink into the centre of your palm. And this is the technique I use it on carpal tunnel clients as well, but it's also very effective for Dupuytrens as well.
Carpal tunnel's across here, isn't it?
Yeah. the surgeons tend to just snip down the middle. It's about, carpal tunnel is about that wide, and will thicken the. It's a bit like having a tunnel with the lining that keeps thickening up, and as it does so, it squashes everything that has to travel inside that tunnel: the tendons, the ligaments, the muscles, the nerves, and the arterial and venous supply as well. They all get squashed, and that causes a tremendous amount of problem and pain in the hand itself. So we're just looking into the thumb webbing here, and we can feel you've got a very slight thickening at this point here, haven't you?
I got more than I had before, I think.
In there?
Yeah. But I didn't know whether it was because I've been peeling a lot. You suddenly peel 8 pounds of apples, you're doing this the whole time, aren't you?
Yeah, of course, yeah.
But I really haven't changed my lifestyle one scrap, if I'm truthful. I still do everything I used to do. So I think that's good, because Christmas I was in a lot of pain with it, and I can feel it tightening up after about 3 weeks, and I can't bend it like that as well. But other than that, it's not bad, is it?
No, it's very good.
And after all, it's wear and tear as well, because they've been used an awful lot through the years.
Oh, they certainly do. Hands get a tremendous amount of use. And the function of the hands take up a huge area in the brain as well. And sometimes a lot more space on people that, specialise with their hands, like piano players and people like that.
Well, I spent my early life as a secretary, so across those typewriter keys you really flew.
A little bit of tension there, isn't there? And
but it certainly is better than it was when I first came.
Oh, definitely.
I don't get the pain in it like I used to.
How's this at the moment? Is this just pressure?
Yeah.
Okay.
No, I yell if it hurts.
Yeah. Anytime any of this hurts, I want you to tell me, then I will back off the pressure.
No, it's fine.
Okay, there we go. What I'm going to do, I'll do the point on the back of your wrist at the end of this session, because
that's not part of this.
Yeah, not a direct part of the Dupuytrens session. So we're going to swap over hands in a second. We're going to do the other hand. Okay. And turn it over for me. There we go.
And we've sent to America. Oh. Yeah, we've sent to America for a new caliper thing for Vic.
Oh yeah.
This one goes up the leg, and straps underneath, and it's got a hinge on it. So as he tries to drop it down, it'll bring his foot back up.
Bring it back up. Oh, that's great.
He's not getting anywhere with the health service. I didn't expect him to. But we saw it online months ago, and and we couldn't find the flipping site for it. So Jeff spent a couple of hours one night. I found it. I said, we'll just get an order it. It's a left size 10, so it's sort of much better than that other dangerous thing. So we're just waiting for it to arrive now.
Yeah, the other one was too small, really, wasn't it?
It was, as you say, he could have tripped and
well, it was a liability because if the elastic snapped, he wouldn't know that it had snapped, and then he would go over on it. So
no, this he'll definitely know. It looks like an old-fashioned caliper with a foot bit that comes underneath, and it showed you on there people before, and the same people you watch them being strapped into it, and then them walking. It's not 100%, but it's about 95%. You'd not know there was anything wrong.
Does this knuckle ever get sore?
No.
Okay.
I think it's just funny because my rings.
Oh, because of the ring.
Yeah.
No, that's okay. I knew something was different about it, and I can see now you've got the rings there. That's what I picked up on. But it shows you that it does a bit tight under the rings, where the rings are probably creating a little bit of pressure there. Okay. Turn over.
How's your mum?
Yeah, mum and dad are fine. They just had a week down in Exmouth.
Oh, that's nice.
So they had a nice time down there. Oh yeah, see, it's doing the same on this side, isn't it? In that webbing, in that webbing space.
Is that because I hold the needles, do you reckon? So you cup your fingers, your thumbs around your needles?
Yeah, it's... What your body's doing is, because of the tension lines through there, it thinks it can help you by creating a thickness there that was going to help you grip. And that's what is fine ordinarily, because once you stop doing the gripping, then that potential to thicken up that section actually disappears. But I think with Dupuytrens people, it just goes on thickening up all the time.
What's the youngest Dupuytren?
Well, it's extremely rare, but it can happen even in very young children, babies even. Oh. I've seen a photograph of a baby with a bent finger right the way in, so it must have started while it was in the womb even. So, but normally no one under the age of, it's very rare to get it under the age of 50. But even if you say only, say, 5% of people that get Dupuytrens get it under the age of 50, you're still talking about large numbers of people overall. And the younger you get it, the more likely it is to actually be very fast growing. So you'll actually get a finger that will go 6 degrees a month. All the way into the palm. So this is partly why I'm doing the videos, is to actually get people aware of massage. They can show the video to their massage therapist, and their massage therapist can make up their own mind as to whether or not they feel that they are competent enough to go ahead and tackle the Dupuytrens. So I'm going to get not just myself, but I'm going to get the other two ladies over in Canada that inspired me, Stacey Barrett and Lee Calpin, to actually do their own videos, so they can actually provide support, that it's not just one lone massage therapist in the world doing this kind of work, that it is actually being undertaken by more than just one lone therapist, that there are a few more out there that are taking it on, and then hopefully the video will inspire many more massage therapists to use their skills. Bit sore along there?
Not
a little
really.
bit tight.
There's so much you don't know about your body, isn't there?
It's the body-brain relationship that is really interesting at the moment. That's where, you know, I thought I'd learned everything I needed to know about soft tissue, but now I'm learning more about the nervous system. That's proving to be even more important, because you can put more bits of the jigsaw together if you have that extra knowledge that you can't do if you just tissue based. So that's a tight spot there, yeah? And then you've got another tight spot there.
This hand seems to be getting tighter, doesn't it?
It's, I think what you'll find is that you know, you've got an increased awareness of your hands, obviously. So when they do tighten up a bit, you'll be a bit more concerned than you really ought to be. But then, you know, when you come here, that we can unwind a lot of that tension and actually get it to all switch off and calm down again.
Yeah, I can go like the clappers for another month.
It's just finding your way with it, you know. It's going to be unfortunate that there may be some people with diabetes that can't have this as a treatment, because there's a high proportion of Dupuytrens sufferers that do have diabetes.
Why can't you have it if you've got diabetes?
Because it makes the capillaries very prone to collapse, because instead of them being elastic, they become too stiff and they will actually collapse and then break, and then you'll get a huge amount of bruising in the palm. Whereas we don't get that with you now, because we're doing such a lot of warm up beforehand. We're getting everything as elastic as we can before we then increase the elasticity in the tissue by creating a response in the tissue to the pressure that we're adding. And we add that pressure over 60 to 90 seconds. And the reason that it takes that long is that the body is not set up for an immediate response. It's set up to monitor things. Right, okay, that's getting tight there. Come back to that in a minute. Oh, it's still getting tight there. So what will happen is that the brain will actually send a signal to the palm to try and relax as much tissue as possible, because obviously now at a low level we're not causing you pain, but at a low level your brain is very much aware of the pressure that I'm applying to the centre of your palm, and therefore adaptation needs to take place and we need to make it favourable. And by doing that you will actually this response of the brain is in as a reflex to the pressure that I'm applying. So it's not me melting the tissues, it's actually your own brain saying we don't want it this tight here, we better let everything relax. So my thumb is now just slowly sinking in. Okay, there we go. So we're going to look at the webbing in the thumb. That's interesting, because that's eased off a little bit already.
Well, as your thumb sunk in, I saw my thumb coming towards the middle.
Yeah, that's right. That's probably just to do with the pressure that I was using. But if we, let's see, no, it might not make a difference. But as you can feel, this there's a piece of webbing in the thumb here that is the tight point. So I'm now going to get my thumb exactly into the middle of that webbing, and then to create a bit of distraction we're going to find another tight point in the hand somewhere else. There we go, that's a bit tight there. So we're actually doing 2 points at a time for most of the session, because I find that helps create a quicker response somehow. Yeah, notice it because the road is so busy here. There we go. How tight does that feel to you, just there and there?
Yes, I can sort of...
If you just drop the hand down a bit, what we'll do is make it easier for the camera to pick out what we're doing there. Is that wrist all right at that angle?
It's fine.
Yeah,
it's fine. This one feels lovely. Why are my fingers coming in?
Just in response to the pressure, I think.
I've never noticed that before. They move on their own.
Yeah.
It does feel nice when I start to use them later on.
Yeah, because just everything's been loosened off. Yeah, but make sure your rings aren't too tight.
They're not, they're ever so loose.
Are they really?
Yeah.
Oh, right, okay.
Yeah, I have no trouble getting them on and off.
Right, so now we're going to check the back of the other hand.
Thank you.
See how that's coming on. I'm trying to avoid going around that burn of yours.
Oh, so flipping cross. Jam's not supposed to do that. It's not supposed to pop out the pan. But since you've done that, I've never had the pain in the back of the hand like I used to get.
Yeah, that's brilliant. That's good.
And sometimes that was, you know, really what was playing me up.
Oh, more than anything else, I guess. Yeah, it's going to be quite painful because it's going to create a blockage to the normal, you know, movement of lymph and the circulatory systems as well.
It's a lovely day today now.
Yeah, it was a horror on Sunday, wasn't it?
Awful, absolutely awful.
One of my clients was set to do a charity bike ride, but they cut it all short by half. Only let them do half the distance because it was such, you know, miserable conditions.
It was so windy as well,
Well,
wasn't it?
that's what makes it so dangerous on a bicycle, isn't it? You know.
Do you still bike?
Yeah, I'm doing a lot of cycling at the moment because I just enjoy being out along the canal. I wouldn't like to cycle on the roads too much, but given that the canal's just up the road there, I go right up to Rickmansworth and back, so it's about 18-mile
and it's
round
a nice
trip.
bit of the canal, isn't it?
Well, it is and it isn't. It all depends on what section of towpath you're on, because some of the sections of towpath are big lumps of flint, and other sections of towpath that are lovely and smooth and not bumpy at all. You know, so that's the only drawback. And also, the canal has a lot of hawthorn bushes along either side of it, and if they've just come along and given them a trim, you tend to end up with the debris all in the path, and then you come along on your bike and pick up a puncture. Right, there we go, madam.
Thank you very much, sir.
All finished.
Lovely.
Okay.
Yeah.
Jolly good.